Good evening, everyone. Welcome. I'm so glad to see you here. I know we have some other people coming in. They'll be in a little later, but I welcome you and thank you for being here. I'm Sharon Closius. I have the privilege of being the president and CEO of the Valley Community Foundation, which we fondly refer to as VCF. And we're delighted to have each and every one of you with us tonight, getting from good to great health, our Valley's health and wellness now and beyond. We are finding the importance of our health as being critical in having a strong community. And we are privileged to have Griffin Health Services and the Naugatuck Valley Health District here to present on the CHIP, which is the Community Health Improvement Plan. We've made both of the Health Improvement Plan available to you in the back as you're leaving tonight. You'll be able to take it with you. But before I go on, I want to do some thank yous. And first, I'd like to thank Griffin Hospital, Pat Charmel, president of the hospital, for having us in this room and sponsoring this event, helping sponsor this event. We are very privileged to have that ability to have this hospital here. And then in addition, I also like to extend my thanks to Monica Orris, who you'll hear in a little bit, but also with Beth Comerford, who really helped pull a lot of the data and the information together. These are integral members of the Griffin Health team, and they just have done so much, and we thank you as well as Beth for doing all the work to put this together. And I also want to thank my staff at VCF, Valerie Knight DeGangi and Dave Rivera and Victoria and Beth, for all that they've done to make sure that this is going to run very, very smoothly. And I want to welcome everybody on Facebook Live as they did all the work to pull this together. So I thank you very, very much. One of the things that we're going to be covering tonight is, well, let me step back, I'm sorry. I know, Monica and I have not practiced our duo here. I want to just first say, for those of you who aren't familiar with the Valley Community Foundation, what we do is we connect private philanthropy, which basically means donations that come in from individuals and organizations, and we take those funds that come in and we actually put it out to the community for the long-term public good in our communities. So all of our donors and fund holders, they are philanthropists in what we do and the work that we do. And we work closely with our donors and the nonprofits in the area with the same goal of having a healthy and prosperous Valley community. So we share in all of that. And you know, one of the things that, as I said earlier, we're seeing that a healthy community is fundamental to the quality of life in that community. And so we have been working, we've been working for the last 9 years, 10 years, on providing data about the health and quality of life issues in the Valley region, and have been producing, you know, the Valley Community Index, which we are also referring to as the Community Health Needs Assessment for Griffin Hospital and Naugatuck Valley Health District. So for tonight's agenda, we're going to be talking a little bit about the Community Index, and then we're also going to be turning it over to our health professionals who will share with you about what we call the CHIP, the Community Health Improvement Plan. And that's going to be fascinating because it's just a very integral part of the machinery that I think a lot of people really aren't aware of. Here in the Valley, we have a very special relationship with all of our nonprofits. They all work together. Our Health and Human Service Council works together to tell the story of our community. They tell the story of, we have people that are falling through the cracks in this area. We have these different issues that are going on. And so with that working together and that collaboration, it's just critical for what we do. And so, it really is the work of this collaboration with all these nonprofits that pull this data together. And so the health improvement, the community index is done every 3 years. It's part of a process for the community health improvement plan to have this index in place. And the collaboration between all of our nonprofits coming together to say, we need to look at this data, we need to look at that data. And so, I don't know, we have the, could you put the slide up for the contents of the community health? Thank you. So these are the chapters of our community index and what they entail. And it comes together with the collaboration of all of our nonprofits as well as our government officials and our economic entities, saying, what do we need to learn about? What do we need to know of the quality of life of our individuals here in the Valley? So that information is taken and turned into a plan. And I don't think a lot of people are aware that there is a very, robust plan of community health that our hospitals, our health district, all of our nonprofits working together as a collective to be able to work on certain issues that you'll hear about tonight. And what happens after the community index is completed, after we produce this every 3 years, our professionals review it. They look at that data and they say, what are the critical issues that we should start addressing in our area, in our valley? What are the issues that we need to critically look at? And then how can we do it? And they come up with an action plan. And that's what you're going to hear more about tonight. I think one of the interesting formations that has happened for me in the past 10 years is learning about the social determinants of health. And knowing that, how many people in this room have had stress in their life and feel like I'm surprised, not everybody. So that stress, as we know, causes hypertension. It causes heart disease. It can cause different things that affect us in our health. Well, we also know that when we take a look at people that are more on the marginalized, on the socioeconomic, the lower level of the socioeconomic plane, they have a greater level of stress that they have to deal with. And so we see a very big difference when we take a look at some of the health issues with people that are in the lower socioeconomic category versus those that are making, $75,000, $100,000 a year and plus. And so we need to start looking at that and what those determinants, those social determinants are. And why is it causing those things to happen? And we know that the stress level that people have causes them maybe to smoke, causes them maybe to drink too much, causes them maybe to do drugs, all these different things. When they're trying to figure out how to make ends meet, how to come up with the money for housing, to come up with the money for childcare, all of those things cause added stress. And all of us as a community need to say, what can we do? What can we do to help? And so that's one of the big things that we like to be looking at. And so this information, this data, then goes to our professionals, basically, and they come up with this plan. And you're going to hear more about the plan in just a second. There's so many things, and you can only address and really work on a few things at a time. And so without further ado, I'm going to introduce Jessica Christie and Monica Orris. Jessica is the health director over at the Naugatuck Valley Health District. And Monica is the director of population health here at Griffin Health Services. And they've been instrumental in working with community members on the Community Health Improvement Plan, which we refer to as the CHIP. I won't go into all the detail because I hope you will enlighten everybody. Now, you may have questions. Please hold those to the end of the presentation. I'll come back up and we'll have a Q&A at the end of the presentation. And before you do leave, just know that there is at the back the chip itself, as well as shining a spotlight, and you'll be able to connect with how to get that information. So,
Great, thank you. Thanks,
there you
Sharon.
go. Thank you.
Thank you. So just to quickly review the agenda, we're going to review the CHIP Community Health Needs Assessment. The CHIP is what Jess and I are going to really focus on, the priority areas, what's next, and just some closing remarks. So we'll try to get you guys through. And hopefully everyone grabbed a food box, certainly on your way out. If they're not all gone, feel free to take one home to a family member because we have lots of extras. So please take advantage of that. Do you want to go through this really quick, Jess?
All right, so thank you, Sharon, for the introduction and our explanation of the Community Health Needs Assessment, or what we call here in the Valley, the index. So you may hear the word Community Health Assessment, or CHA, Community Health Needs Assessment, a CHNA, or we make it easy and just call it an index. This is something that is done, as Sharon explained to you, in a very collaborative process. We'd like to also extend our thanks to Data Haven, which helps compile all sorts of data from different sources, things that we look at every day, things that we look at quarterly, biannually, annually, and sometimes, over a longer period of time to set some trends. So it's inclusive of different chapters, but what we are particularly interested in is the public health and the healthcare impacts of the data and what we can do to help improve it. So you'll see, again, there's page reference numbers, so do please make sure that you look at the index if you haven't already done so, because it is the foundation for a lot of our work. And so the what and the why, right? So we have this index with a lot of information, a community profile, health information, economic growth or changes in the community, but it's a lot to digest. And so what we need to do is kind of hone in and find actionable items that we can prioritize and try to work on over the next couple years. We know that we're not going to be able to solve all of the problems, although we wish we could. Mm-hmm. We know that some of the issues are going to carry over into multiple years or years long. They may be long-term issues. We may have recurring themes that are in our index that already have a lot of resources allocated towards them, so it made sense to look at what other options are. But our main objective at the end of the day is to try to hone in on strategies that we can really make improvements and impactful changes for the public health in our Valley region. And I do want to clarify, when we talk about the Valley this evening and as it relates to our index and our CHIP work, we are including the communities of Ansonia, Beacon Falls, Derby, Naugatuck, Oxford, Seymour, and Shelton. 6 of those towns are covered by the Naugatuck Valley Health District, with the exception of Oxford, covered by the Housatonic Valley Health District, our partners who are also participating in this initiative.
Okay, great. Thanks, Jess. So one of the things I wanted to share is that the other thing that's been happening at the state level is something called the SHIP, the State Health Improvement Plan. And just to give a little bit of history, this really came about from the Affordable Care Act in 2010 about Obamacare. They started saying, okay, we want to have more focus on community and how community health impacts overall health, right? So it makes sense. So it's been 10 years, right? 2023, 2010 is when I think it was initiated, and I think it was started to roll out in 2013. So it really has been a decade of this work. Every time we do these CHIPs and CHAs, I think we get a little bit better at it. We get a little bit more efficient at it, and I think that continues to happen. But what's interesting is that the state does the same thing. The state does a community health needs assessment at the state level, and they look at priority areas that the state should be focusing on. And the 4 priority areas that were identified at the state are access to healthcare, economic stability, healthy food and housing, and community strength and resilience. And I think all of those are pretty clear. Economic stability is, housing and economic development to support. Some folks might have been at the team breakfast this morning. There was some information going on about that. Community strength and resilience encompasses a lot of the behavioral health and substance use challenges that are happening statewide. So just keep that in mind. And one of the things that the state likes to see is that the hospital systems and the health districts are aligning as much as possible with pieces of the SHIP, because the more we can do together from a bigger picture, and then when we break it down at the community level, the stronger we can be. So there's sort of strength in numbers, if you will.
So I will say, even though we just told you there is a SHIP, a state health improvement plan, and we are aware of it, we didn't want to create any prejudice or create any preconceived notion that these topics should be our CHIP as well, our community health improvement plan. So what we did is, years ago, we realized that, the Naugatuck Valley Health District, the local health entity in the valley, needs this community health assessment and this community health improvement plan as part of our public health accreditation requirements. We are nationally accredited, which comes with a little bit more extracurricular activities, including these two big projects. Similarly, Griffin needs both of these documents for their requirements. So Monica can talk a little bit about that.
Yeah, just as because we are a tax exempt hospital, we have to provide community resources and showing how we're supporting our community in different ways. So it's just a federal requirement. We have to show it every year in our taxes, and we have to present it to our board of directors every year. They have to approve it. We have to give them updates every year, every quarter. And the state is getting a little bit more strict about it, because they want to see, okay, we've been at this for 10 years now. You're saying you're doing this work. We want to see that you're doing this work. So this is one of the first years they're actually saying, as a hospital system, we want to know what your community health improvement plan is, and we want to know how what activities the hospital is specifically doing to contribute to its activities. Not only that, but they also want us to give dollar amounts. How much time and energy, am I, other staff members that are working on the community health improvement plan, how much time and in dollars are we giving to our community? Because they want to see, how much time is it? Because we've all been saying it for 10 years now. It's a lot of work. This is not easy work. It takes a lot of time. We have full-time jobs, so this has become sort of another full-time job. And we want to move the needle. So the more help we can get from community members and community buy-in, the stronger we will be. So Griffin Health does have a requirement, and it's really important. It's becoming more and more important, and I've been sharing that with the steering committee as well. So this just gives you a quick timeline of what the index unveiling to the CHIP and where we sort of are now happens. So we looked at the data, we met with the CBOs, and we did the unveiling of the index on November 15th of 2022. We then met again a couple times, and we said, okay, let's look at the data and see what are some of our challenges. Are there any new challenges? We certainly know COVID happened during the last CHIP and this CHIP. How impactful is that going to be? We did look at 5 priority areas that sort of surfaced according to folks in the community. And I will say that it wasn't just like community leaders that work in the Valley. We really brought in some folks that live and community members in the Valley, because we wanted to hear from them. And that was one of the things we did this year that was really interesting, that made our index more useful, is that we had listening sessions. So we went around to Oxford Senior Center, Smithfield Callahan House, which is a senior housing, but it's disabled and senior housing in Seymour. We went to a few different groups. I think there was a YMCA in Naugatuck, and we asked questions like, what's difficult for you? How hard is it for you to get care? What are some challenges? And we really found some very interesting things. And in the index, we actually called it out. There's like a little ear for a listening session with specific call outs that explain some of the things that our community members told us. And really shocking, I tell this story and I'll be really quick, but in Oxford Senior Center, they said, we have such great services, we have vans, we have transportation. They allow us to take as many grocery bags as we need on the vans. Someone helps us with with the grocery bags. We go to farmers markets, medical appointments. We love it. Well, Seymour Callahan House, 3 miles down the road, very different picture. We don't have enough services. We only use Valley Transit. We can only go to certain places, certain days. We can only take 2 bags. We have to bring our own bags. No one helps us. Transportation is a big challenge. So the disparities between the towns was evident. And the data that shows, that Jess is going to go over in a minute, shows some of those disparities. So we talk about health equity and disparities. Those were really evident in some of the data, and it matched with some of the information that our community members shared with us. So that was something that made this really interesting, and I think that was helpful for all of us to sort of hear and see, and I think it made us really realize, wow, we have to really start listening to them more. So there was about 30 people from our local CBOs, and we did break it down to 3 priority areas just because it helps us focus when there's 3. In the past, there was as many as I think 7 one time. Mm-hmm. So, and it was just sort of too diluted. So we said, let's just focus on 3. And we created work groups for each priority area, which had members of the community-based organizations as well as community partners when we could have them. And we had open recruitment. We said anyone and everyone could join. And that is one of our challenges. How do we get the word out for community members to join? It's not easy. So if anyone has any ideas on that, we could maybe bring that up during our Q&A. And we still have ongoing listening sessions and data collection to still hear from community members what matters to them. So the timeline down there sort of explains, specifically dates and what happened and when they happened. Okay, I think this one was the 5 different options, and then the next one is yours, Jess.
Yeah, so of course, as Monica mentioned, we had a lot of information. We drilled down 5 reasonable topic areas by vote. Mm-hmm. It was a great exercise. There was a lot of discussion that night on kind of who can I get to sway towards, my priority area, or, is this, our work was work already being done towards this, or is maybe another established group like the Valley Council for Health and Human Services already trying to address this? So when we looked at those 5 categories that were kind of honed in that night, we had access to healthy food options. I think we heard that earlier in the state health improvement plan. Chronic conditions, something that we work to address every day, both in the health department and the hospital, as well as a lot of our partner organizations. We heard a lot about mental health, and we heard a lot about mental health the day of the index unveiling when we did a live sort of survey from the audience. We heard about it when we went out and did those listening sessions around the community. We hear it in our day-to-day conversation with our peers, our colleagues, the people that we're serving. Equitable access to health services. This one morphed a little bit. It started with access to health and social services, and then it was, well, can we really improve or make that change from a volunteer collaborative effort, or can we try to shed light on equitable access to health services and some of the barriers that our community members are experiencing? And then substance use, which was in the previous iteration of the CHIP under a behavioral health umbrella, but we wanted to really kind of hone in on substance use, and particularly looking at the opioids crisis we continue to face, not just here in the Valley or statewide or nationally, but also consumption of alcohol, which we have high hospitalization rates and know that this is an issue in our communities, as well as the consumption of tobacco and cannabis products, specifically through vaping and looking at our younger population. So by the end of the night, those 3 in the purple, blue, and yellow ended up being our 3 priority areas or our focus areas. Mm-hmm. And Monica, alluded to, I wanted to talk about some data. The data that you're going to see on the next 3 slides are pulled out of the Valley Index. So this is going to look familiar to you if you haven't already reviewed it, or it should look somewhat familiar to you. And it really supports the feel of the room and the vibe of the room and the just perception of what our priority areas should be. And when you look at some of these, You'll notice on the left-hand column, there's Connecticut data, there's combined Valley data, which again includes the 7 towns. But then when you look at each individual community, you start to see those disparities, like we were saying earlier. You start to see that maybe as a Valley whole, yeah, we might be under the Connecticut average, but when you look at some of our communities with particular correlation to mental illness, significant, higher than the rest of the Valley. When you look at substance use, we're above Connecticut standards in many of our towns. And, I would be willing to bet that fluctuates probably even more than what is depicted here. Alcohol consumption, again, we have high rates within specific communities and within specific areas of those communities. When we looked at the survey data that was presented in the index about young people and how they felt their mental well-being, 20% of our Valley youth felt like they were hopeless, sad in the last year. Coming off of COVID pandemic, may have had something to do with it, some isolation, some big changes with missing school years or school days or friends, but needless to say, 20% also had thoughts about hurting themselves. That is a big number. And then when we look at substance use, 35% of Valley adults know someone who has struggled with an addiction to heroin. 52% said that it was a family member or someone close to them. These are real issues that are impacting every single one of us in one way or another. Again, we also have data comparing the Valley to Connecticut, and you'll see with smoking cigarettes, vaping in general, and using marijuana, we are higher than the Connecticut average, so that tells us something. And then finally, barriers to healthcare is another snippet that we wanted to call attention to because it directly relates to our CHIP. We have data on people that, based on income levels or different things like race and ethnicity or family type, why are they delaying medical care? Why don't they have a medical home? Why are they relying on our urgent care centers? Those are great to have in the community, and we are grateful to have many providers, but to not have a consistent medical home or follow up on regular checks or wellness visits or things like going to the dentist or the eye doctor, and I'll get to it, and then 10 years goes by and it's too late for some people. So this is where we kind of aligned with that equitable access to health services. Again, our 3 priority areas: mental health, substance use, and equitable access to health services. The cover of the CHIP looks like this. So for those of you online, you can certainly hit the hyperlink to it. If you're in the room, grab one from the back. You can also scan the QR code or visit Griffin, Naugatuck Valley Health District, or the Valley Community Foundation's websites to find the respective documents. A lot of text, a lot of bubbles. We're not going to read it all. It's just to show you how we display what our intentions are within the CHIP document. So I'm going to highlight the first 2 priority areas very briefly and some of the work that we've accomplished so far over the last couple months, and then I'll turn it to Monica for the 3rd priority area. Mental health is, again, a huge one. We have a really strong working group thanks to our co-facilitators, and I would be remiss if I didn't mention Lisa Troop from Naugatuck Valley, who has really been pulling together the work of this mental health group. We wanted to, by way of this mental health group, which again is made up of volunteers, people doing this work after hours, after a long work day, people that are from the community volunteering their time because they have a vested interest. We wanted to develop a mental health resource directory, something with really specific information so that people know whether they're in a crisis or whether they are just in need of a service, where to go and where is accepting new patients, where is accepting my insurance, what is the wait time going to be like to get an appointment, if I can even get one. So we talked about that. Another key activity that we wanted to do was increase our mental health programming out in the community. I have to, applaud and congratulate the really attention that this chip has put on mental health, suicide awareness and prevention in particular. Lisa has gone and performed question, persuade, and refer, or QPR for short, suicide prevention training for all faculty of Ansonia Public Schools. That is a huge accomplishment that is a byproduct of a need for our community relating to our CHIP work. And that's the type of stuff that we like to see happen and is especially rewarding when it's so impactful. The next priority area is substance use. And as I mentioned, this sort of rolled over from previous iterations. This is a problem that unfortunately we know is not going to just poof and disappear and go away. However, we had the opportunity to really assess what we've tried to do in the past and what was successful, or maybe what needed to pivot and have some different changes. So we wanted to look at additional evidence-based interventions and programs. We've done a lot of community naloxone or Narcan trainings, opioids awareness trainings. They are great. They will continue to happen. That is definitely a priority. But what else can we do? Well, we can do another evidence-based program called academic detailing and meet the providers, the people providing prescriptions, the pharmacists, and educate them on how what they're prescribing is impacting our community members. We can show them data. We can do other approaches. We also wanted to create a resource directory for people experiencing substance use or misuse or dependence. And that also is a common theme throughout. I think aligning and not reduplicating or duplicating or adding more work to our plates is important. So we acknowledge that the Valley has an opioids task force in existence. So we said, great, let's combine forces. Let's use the same meeting team, be stronger in numbers, and accomplish what we need to do. And then the final one, I'll turn it over to Monica.
Yeah, and just wanted to share that one of the things that Griffin has done, I just spoke to Joe Burnett before I came in, is they are doing what's called a Narcan Leave Behind program. And Griffin, remember I talked about having, some financial backing for certain interventions. That's one of them. So Joe said that he's working with Echo Hose in Shelton and VEMS, which covers 5 towns in the Valley. And they're actually, he created this whole project, him and Lisa Jaser and our communications team at Griffin, where they created this Narcan Leave Behind. So they leave 2 nasal Narcan sprays in, a griffinized, of course, like little kit. And Joe looks at the EMS report every Monday and sees if there's someone that had an overdose call in the last week. And if they did, he calls them and he says, hi, I see that do you think that you would benefit from some Narcan and having it on hand? Because he says you have to be sensitive. Like, what if someone had almost had an overdose, but it was it was a 21-year-old kid and their parents didn't know about it? He has to talk to the person. So if they say yes, he calls the EMS takes it and drops it off. So Griffin has invested some dollars in this Narcan Leave Behind program to help with one of the priority areas here. There isn't a huge turnout for it, but there's a small investment that Griffin made, and it's a small drop in the bucket if we could save a handful of lives, right? So that's one thing that we did do. So equitable access to health services is the last priority area that we'll talk about tonight. And the goal was to really gain a comprehensive understanding of access to health services, which are all-encompassing. It really includes social services, medical services, dental services, behavioral health services. And, resource guide is such an overused thing, but guess what? When we ask people out in the community, where do they get their information? You'd be shocked. Oh, a friend or a friend of a friend, or, we didn't know where to turn. Or if they Google something, but it's like in another town or state or out of their region. So we are trying to create this really robust resource guide of all the different services what insurance is accepted, hours of operation. And what we'd like to do is have that in a centralized place, of course, but see where there's gaps. And we've already found that, when we realized that there was patients coming into the emergency department, one of my teams on the Pop Health team would call and say, all right, you need to call your primary care doc and go see them. And guess what? They'd say, well, I can't because I work full time. I can't leave work to go see a doctor, and they don't have after hours. So we have started having more and more after hours appointments to accommodate people who work, which seems like it's such common sense. But sometimes when you see it and keep hearing it again and again, you're like, we have to do this. So we have Saturday appointments, and they're doing the same thing with behavioral health. They created an extra office in Shelton. They're doing more weekends, they're doing more evenings, and I think they're creating another behavioral health location in Hamden because they just can't keep up with all the appointments. So equitable access to health service is something that we're trying to dig a little deeper into. So getting a resource guide, understanding what the challenges are. Does everyone have access to Language Line? We find that there's some people that, maybe can't either read or write or speak a different language. So what do they do for those members? That's a big challenge. So what we're hoping to do is sort of get a little bit of a gap analysis and then create sort of a one-pager to deliver to all the providers in the Valley to say, we found out this information and here's some things that you should consider doing to improve access to health services for your practice. And it's sort of like a little bit of a scorecard, if you will, to sort of improve what they could do. Now, whether or not they can or can't do it, those are going to be things that we'd like to maybe survey them and take to maybe an advocacy at the state level to say, hey, these providers are struggling because they can't afford Language Line. Is there funding, grant funding? These are all things that we uncover. We become these like private investigators doing this work. So there's a lot of really great work that's happening and will continue to happen.
Yeah, I think it's important to acknowledge, we have resources that exist, like 211, for example, which is a great resource statewide. You can call, you can go online. But oftentimes, providers, stakeholders, people that are trying to make those linkages to care, we can't see if that loop was closed. We can see the data of how many calls were made looking for a service, but we don't know if those people were actually connected with what they were seeking, or if it was appropriate, or if the provider had open appointments, or whatever the topic is. So when we were thinking about what would be useful for us, for the residents, but also the other stakeholders in the community that we want to engage, we thought we needed something with a little bit more transparency and information available up front. And so the staff at NVHD, an intern over the summer with Griffin, they cold called hundreds of providers in all different categories and really surveyed. We want to know, what are your hours of operation? What is your realistic timeline? Are you accessible for handicap? Are you able to do languages? What insurance do you take? And we found out some interesting information from some of these providers that was like an aha kind of moment. So that's why Monica mentioned, we want to relay that information back to them so that they know really what the picture looks like in the Valley, but we also want to produce something and be able to sustain something that is a publicly accessible tool for our community members as well. So stay tuned for more information on that as we progress through the CHIP, and we'll talk about that a little bit later. We have to hold ourselves accountable to this work, right? So it's not just the hospital, it's not just the health district. We have a lot of you in the room tonight, maybe watching online or watching at a later time, that have had participation in one way or another. We mentioned there's open recruitment. If this sparks an interest or you want to just learn more, give us a call. We're open arms. But we do have to hold ourselves accountable. So we have these working groups that are made up of rosters of fantastic people giving their time. And we have a steering committee that oversees the work that's being done. We have certain reporting requirements for accreditation for the health department, for Griffin and the state and what they need to report. But we also need to be able to track this to see, are we making any progress? So the steering committee is meeting sometimes as frequently as weekly, sometimes monthly, and then eventually maybe quarterly. But it's a lot of work, but it's all documented, and it really helps us paint that picture so that when we're doing our analysis, we can show exactly what was done or what gaps still exist. During the month of September, we decided to pivot from our traditional public sort of interviews or forums. We were successful at some of these events for the index and meeting people where they were already gathered or had a meeting time. But we found that when we were trying to survey the public or invite people to a listening session or a focus group, that we weren't really getting the turnout that we needed for whatever reason. And so our staff had completed what's called a rapid community assessment on a different project earlier this summer related to immunization and vaccine hesitancy. But they were able to get so much information in such a short period of time that we said, let's adopt this model and try it. Let's see if it works for our CHIP and the information that we're trying to get from the community. So over a 3-week period, we held planning meetings. We set up teams of generally 2 or 3 people. Pictured here are some of the NVHD team members, Nancy Serrano, Vanessa Lopez, and Joan Lane at a Naugatuck event. But they were able, in just 1 week's time, interview 70 different people and get really valuable information from 70 very different people across the valley. And simply just, hey, do you have a few moments? I'd like to talk to you about, are you having any trouble with any access to health care or social services, or what have you been hearing? And so we're now analyzing all of those interviews and trying to see, okay, what is this telling us? What kind of story is it painting? And is it consistent with what we're trying to do and the change that we're trying to make? So as we finish our analysis, we will continue to report back to all of our participants, our community, our stakeholders, and the members of the Valley community for, our Valley Council for Health and Human Services, as well as the Greater Valley Chamber of Commerce Healthcare Council, because we want to make sure that they're kept in the know too. And you'll see this Venn diagram on the screen here. We have some overlap, and I'll let Monica talk a little bit about what collective impact means, but we don't want to duplicate, we want to complement, and we think that this resource hub that we intended to create and that the Valley Council also intends to create, we're coming at it from 2 different angles with a lot of great information, and this is an opportune time. So,
So this diagram is really great because it shows, certainly what the CHIP body of work is, which we sort of went over pretty quickly, but it's a lot of details if you want to read through it. And the collective impact model is really what we're doing today, what we're doing with the CHIP, but it's more of looking at current models that are happening in the community and utilizing existing groups, existing resources, and trying to band people together to move the needle on important things that affect everyone. I always say that we work in silos so many times. We're doing something, and Naugatuck Valley Health is doing something, and all these groups. So if we can all get together and talk about what we're doing and try to swim in the same direction, we'll be a lot stronger because of it. So the Valley Council for Health and Human Services just received some funding for 3 years, and what they're hoping to create is something called a community hub. And the community hub is basically going to be a live website that has very specific information about services in the Valley, all encompassing medical, dental, behavioral, substance use, social services, everything, activities, where you could exercise. We saw some information about the paddle boards that are happening down on the river. All of that information, and then maybe a separate section for providers, so they could understand maybe what type of demographics are here and what languages folks speak and what they should consider when they have new. So that's the kind of information that the Valley Council wants to have, which really aligns so perfectly well with what we're trying to do with our CHIP. So doesn't it make sense to have a shared agenda and a shared goal? so that we could all sort of swim in the same lane and really have some strength in all the work that we're doing. So I think it's really exciting. Griffin is going to be the backbone for the director of the Valley Council for Health and Human Services, really just sort of to provide space, a computer, and support, but having a neutral party that sort of works for all the Valley members, whether you go to Griffin for services or Yale or Hartford, doesn't matter where you go for healthcare. But if you live or work in the Valley, this community hub would be really helpful for you. And this director role is going to be sort of taking that to the next level. So more to come on that. That's going to really be probably in the news in the next few months, and really front and center for many community meetings.
So if we haven't reiterated it enough, here's another polite reminder.
Memorize these over the next weekend.
On the left hand, we have understanding the Valley region. So this is the large a large community health needs assessment, the index. There is a sort of executive summary, which is called Shining a Spotlight onto the Valley region, which is available here. It is available online too. It's not QR scanned up there, but it is available. And this gives you the highlights. But the larger document is up there, and it's worth a read if you have any interest in those chapters. The Community Health Improvement Plan, again, is the CHIP, and that's the document on the right. We will be publishing our progress reports coming up soon, so those will be available for public consumption as well, so you can see all the activities, because tonight we just did a sliver of the work. There's really so much more to it, but we were so fortunate to hold your attention this evening. And without further ado, I'll turn it back to Sharon.
Well, thank you. Please help me thank Jessica. It's wonderful. This is just a wonderful collaboration between the Naugatuck Valley Health District and the Griffin Health Services. And we are so pleased as the Valley Community Foundation to bring these type of programs to you, because I think a lot of people are not aware of all the work that goes behind the scenes. And here in the Valley, it's a very, very special opportunity because they're so accessible. You're so accessible, and you just can get involved and be part of that voice that they need to hear. So just before I open it up to Q&A, I just want to let you know that you're going to be receiving an email tomorrow asking you to fill out a very short survey about this evening's event. And here's just an example of, this is the index. So I have it up here if anybody wanted to actually see what the index looks like inside. So I'd like to welcome any questions that you have for anybody. Yes, sir.
Yes, my name is Christopher Joe. I'm happy that you guys are doing this. I'm in Ansonia, but not originally from here. Mm-hmm. And Governor Lamont cited fairly recently, oh, sure. Governor Lamont cited fairly recently, which I'm sure you're aware of, that there is a major shortage of real affordable housing, mm-hmm. especially for senior citizens. Mm-hmm. There is like a 3 to 4 year waiting list almost in every single town and city. And my question is, are you looking at this? Are you looking at ways to improve this problem in the Valley area?
Yeah. So that's a big one. I know it's such a challenge, and my team, my population health team, I'm sure Jess sees it too. We get the calls we get, mother, daughter living out of their car, daughter's going through cancer therapy, mm-hmm. just lost her house, can't get, the stories we hear are heartbreaking. And guess what? We send most of those folks to TEAM, 211, which is a coordinated access network. They have to fill out forms to see,
That's in Derby.
Yes, yeah. TEAM is in Derby. They're the community action agency that we refer to.
Okay.
But there is also something in 211 where you could actually apply for emergency housing at shelters. but because there's not enough housing complexes. I do know that they are working really hard on creating some new apartments and lower income apartment buildings. They just can't build them quick enough, unfortunately.
And it's not only here.
No, it's
No.
not only here, it's
Throughout
across,
the
it's
entire
across the
state.
country, and it's across the country,
Really?
but in the state, it's pretty bad.
Yeah, and I think this is a great question too, and certainly a topic of great importance. And when we were looking at what topic areas we were going to focus on, housing was really up there. But for us and the efforts that we were trying to do by way of the CHIP, we didn't think that we could have attainable, goals and objectives that we could track over a short period of time. But what we do in our regular work is work with other members of the Valley Council for Health and Human Services, our local delegation, and we try to raise as much awareness as we can. And actually this morning, a lot of community members, 240 some odd people, got together in one room to celebrate Team's annual celebration. But housing was a big topic of that, and it was, we have to talk about it, we have to be honest about it, and we got to try to figure out how to solve almost an unsolvable problem. But it is certainly something that is a theme throughout both the index and our regular day-to-day work.
Thank you.
And I'm glad you brought up the housing. There are so many, the way that the Valley organizations, nonprofit organizations work together is phenomenal. And I'm glad you're going to have, we're going to have your email address to be able to keep you informed at the different forums that are going on. Because I do know that Team has done a couple of forums on affordable housing and what can be done and how to start addressing it. So thank you for bringing it up.
Yes.
Any other questions in the room?
I'll go again. Which is another important item that you guys are looking into, and you just somewhat mentioned, is obesity, especially in young people. I'm not going to say Griffin Hospital. It's everywhere. Every employer. I question this. I say, how can human resources hire a person and you're looking at them and they check off they're in perfect health when you can see they're not? And you're looking at blood clots, maybe strokes, and other major problems. How are you addressing this, or even attempting to address this? I see it at the college that I go to at Western. Young people that can barely walk. 5'6" lady, she's 375 pounds.
Yeah.
And like you mentioned, health problems. So that's what I'm asking.
Yeah, so, from the health department standpoint, obesity, other chronic conditions is certainly on our radar, and something that is also really defined in our index with data and rates specifically to overweight youth and adults and obese youth and adults. When we sort of look at our projection for the year and where we're going to prioritize our programming, our services, where we'll look to our funders like the Valley Community Foundation and others, we start to think about, okay, what are these issues, right? And we see it, we see it coming up. We do a lot of work with diabetic individuals. So Lisa and some of our other staff run evidence-based programs over 6 weeks and educate these people on lifestyle changes and their caregivers or family members that maybe want to attend. We have in the past worked with registered dietitians that work in our local grocery stores that can help people shop smarter and shop healthier, that maybe they just need that education on how to read a food label or understand good and bad fats or sugars or things like that. So a lot of it is health education and awareness, but some of it is underlying issues and trying to get people to change lifestyles, and maybe sometimes people are stubborn and don't want to be told to change their lifestyle. So that can be difficult too. But whether it's obesity or other chronic diseases, both Griffin Health Services, our office, Naugatuck Valley Health District, And a lot of our community partners that participate in the CHIP effort run these programs for free at no cost to the residents. So, we'd be happy to share any information about upcoming events. You can certainly contact Monica or my office, and we can help, steer anybody to anything that's coming up.
I think that's one of the challenges that we face. We talked about this earlier amongst us, is communicating. This is the media. We don't have enough resources and sources out there to spread the word. And so the more that people like in this room can help spread the word. I know you came to us because you heard us on the radio
Yes,
with John
I did.
Boquette, which is great.
Thanks.
I do.
John, yeah,
Someone
there
heard
we
us.
go.
He's got some interesting,
Yeah, so,
Yes,
so
yeah.
we are trying to find different ways of getting the message out. So all of you in this room can do that. And one thing, just because I saw another hand come up, but one of the things that was interesting, it was probably 4 or 5 years ago, that Griffin said, if we're going to be hosting a meeting, we're not having cookies and muffins.
Oh, yeah.
Right? I mean,
Yeah.
you're not having those at Griffin.
Yeah.
You are having healthy snacks, protein bars, or whatever it takes. And so each and every one of us, think about if you're in the office or what, if you're bringing the donuts in, you're contributing to the problem. So you may want to be thinking of those things, because each and every one of us can help share the message one way or another. So, Pat?
First, thank you. That was a wonderful presentation, and it just really makes me feel so happy to think that this effort is really happening. Obviously, I have a United Way background, so when you say 211, I'm wondering whether or not you have a direct line to 211 that collects all the data for the Valley, and do they provide that to you?
So there's actually a public-facing portal called 211 Counts, and anybody could go online. 211counts.org, I believe, is the website. You can search by zip code, by community name, so you can type in Derby or you can search the zip code, and you can set a time period, so you can look at the last month, the last year, over whatever period of time, and it will show you all of the call volume by actual tally count, so 1, 2, 3, 4, 5, 6, so on, calls for this category, this category, this category, or it will show you a percentage of the calls that were allocated towards those services or those requested services. 211 Counts is helpful to us because we know, particularly with things like mental health or recovery or crisis intervention, that when we see really high numbers in our community, we know that people aren't sure where to turn locally, right? So we're aware of it, we look at it, but as I mentioned earlier, we're not able to see if those people were connected with what they actually really needed. And that's no fault of 211, it's just not, realistically able to track. So we're hoping to leverage this new resource hub and some of the other new tools that are available to healthcare, public health, and community-based organizations to really follow the person from their services that they need and require, new services that they're looking for, and then making sure that they were able to actually get what they needed or what they were looking for.
Yeah, and we didn't really get into that, but
Yeah.
that is something that Griffin uses, Unite Us. That's a social referral platform that Griffin's been using. And one of the things that this Director of Valley Council for Health and Human Services, this coordination hub, will be using a version of Unite Us as well. So we could continue to collect that information, that data, Pat, that you mentioned, because the Unite Us information is really fabulous. It tells you what type of needs someone has, what organization we made the referral to, whether that referral agency accepted it or denied it, and why did they deny it. And then we have a running list of all the different places that person attended over a history. So it really helps us create a picture outside of any healthcare organization, which is really nice. So from a social service perspective, it's amazing. So we will use Unite Us in the coordination hub and in this CHIP work that we're talking about.
And I think too, the development of these types of software and platforms, really breaking down the silos, having public health talk to the healthcare sector, having community-based organizations be able to communicate with both of our agencies and other partner or similar agencies is ideal and seems like a no-brainer, but really doesn't happen all too often. Unless we have personal connections and say, hey, Monica, or hey, Jess, I have someone that needs this, where can I send them? It's not happening on a more streamlined basis, but it's starting to, and that's really encouraging and really positive. But these programs, these software, these resource hubs, they're only as good as the information that's put in it, right? And the participation and the buy-in. So that's why we stress when we say we don't want to just develop something for the community members, the layperson, the general public. We do, but we also need the buy-in from the providers and the people that are going to spend the time to record that information to make those linkages to care. So more to come. I think we'll have better data as the years progress and as we start to adopt these new software and technologies, but it is something that we are certainly interested in and looking at improving.
Thank you.
I'm going to go to the gentleman
Go
behind
ahead,
you.
go ahead, Go ahead.
Given the crisis in mental health, is mental telehealth something that's being employed here at Griffith?
Yeah.
Just want to hear about that a little bit.
Yeah, we are doing more and more telehealth visits for mental health. It's something that more and more, especially younger people, really appreciate. They don't want to come out. They don't always want to be seen. They like to do those visits in the comfort of their own home. So we are hiring more and more providers that are very comfortable and confident doing it. We have a platform that allows for it, to bill for it, and COVID sort of put us on the fast track to do that, and we are doing it. We're doing it more and more and more. To be honest, one of our biggest challenges is to find staff. Hiring healthcare staff is a challenge. Our nurse practitioners, behavioral health nurse practitioners, behavioral health physicians, it's tricky to get the right staff. I'm not going to lie, and I know our staff continuously looks. We're continuously in recruit. We've got some new folks coming in, but it's been a challenge, and I don't think we're different than any other healthcare organization.
I think expanding online clinical services too, for some people that may feel that stigma or that burden, they maybe don't want to go and sit in a waiting room and have people stare at them wondering, what they're doing there. It provides that opportunity and a level of comfort for some. For some, it's still very beneficial to go, of course. And then, as I mentioned before, the QPR suicide prevention training program, mental health first aid program, these 1 hour to 8 hour long trainings designed for the layperson, for the average person, to have a better understanding about how to recognize signs of mental distress, someone that may be acting a little bit off. How do I approach them? I'm concerned, but I don't know the tools or what's available to me. These evidence-based programs that we're providing from the health department and some of our partner organizations as well, like BH Care and others, are really important because the more that we can saturate the community with these programming, the more awareness we can raise and hopefully break down those stigma. And I bet Lisa wants to add a little bit in because
Yeah, just to speak to that, we do have a shortage of clinicians. We know that based on the research that we're doing around the resource directory. We're finding that we're just short clinicians in all categories, but definitely in mental health, and particularly related to the mental health of children. Not a lot of clinicians see children. There's not enough access. So the idea behind QPR, Question, Persuade, Refer, which is a suicide prevention program, but the things that are taught in that program are applicable to anyone in a mental health crisis, whether suicidal or not. And the longer form mental health first aid is to have boots on the ground. Lay people in organizations, it's particularly important with the youth, and I'm so thankful to the Ansonia School District for allowing me to do that program for all of their staff. Naugatuck is also completely done. It was mandated before we started doing it, and they do it rotating. So 2 of the 7 towns that we're talking about have employed that in their staff. But it's also important with seniors. It's also important that staff at senior centers be trained in these kinds of programs, because the mental health of aging Americans is becoming a growing crisis. And the isolation of COVID and the fact that they didn't understand how to use the technology, so they became even more isolated because they didn't have access the way younger people did. These programs need to proliferate everywhere. So anyone wants to run it in any of their organizations, I have business cards. I'll leave them on the table. Please reach out. I'm more than happy to do this for your organization.
Lisa, could you please introduce yourself?
Yeah.
My name
Have
is
that
Lisa
first.
True. Sorry, I'm the health educator for the Naugatuck Valley Health District.
That is the infamous Lisa that I was referring to earlier. She's a plant in the audience.
She's now famous.
I just wanted to thank Griffin Hospital because I utilize the doctors here, nutritionists. I am a senior. I run in marathons, New York City.
Wow.
I'm 5'5". I go down to Rucker Park every year, dunk a basketball for Nike. Do it every year since 1973, the famous Rucker Park, world renowned. What I like, I just want to say very quickly, compliments to Griffin Hospital, because I have a friend works with a lot of Alzheimer's disease people. She's done it for 40-something years out of St. Vincent's Hospital, Hartford Healthcare, but she complimented Griffin Hospital because you're seeing a lot of like Nuvance taking over all these, but Griffin is pretty much independent. And she says that's a very good thing. I do have a question though, and my question is something you brought up. Why is Seymour, which is close to Oxford, why is Seymour Senior Center not getting the resources that Oxford is? Because I spend a lot of time, and I'm going to look you up, I spend a lot of time at the Newtown Senior Center,
Yes.
and they have a major problem with transportation.
Yes.
And senior citizens are isolated.
Yeah.
And I'm just curious.
So I'll start and then I'll let Monica, take over. I don't think it's a Seymour versus Oxford. I think it's all communities versus all communities. I think there are very many positive attributes to a lot of our senior centers. Some of our communities have community centers, not just senior centers or in lieu of. But it comes down to resources a lot of times, and funding and staffing, but also community interest. When you have a culture within a community that over years has really invested into the idea of programming and classes and camaraderie through these locations, it's easy to request, maybe not easy to get dollars, but to make a more compelling case. And in some communities, the need, the desire is there, but unfortunately the resources may not be as accessible or available to them. I do know that we have seen a lot of improvements across the valley in our community and senior centers. Ansonia just opened a lovely new facility. We expect to see some of our other communities make some pretty hefty improvements over the next couple of years. But I think it comes down to, at the end of the day, some of those grassroots causes that are, they're ages long in these communities. It's generational problems that have, just piled on each other. And when you try to step in and fix it, it's maybe not so easy. So I think a lot of it is resource allocation, and some of it is just community makeup and profile and vested interest.
Are you looking at helping Seymour?
Yeah, so we are not a municipal health department like some communities have. We are a district, but we work very closely with our municipalities and our senior and community centers. Oftentimes we run our programs there. So the success of their programs, we want them to succeed because they help us help people as well. So we help promote what they have going on. We try to leverage their existing meeting times, not just to collect data, but let's run a flu clinic when we know maybe it's bingo day or there's a lunch running or something like that. So we try to be strategic and work with leadership at these different community places. The YMCAs are another good example. Trying to leverage those partnerships and help increase awareness and bring more resources in, maybe when sometimes they can't do it themselves or independently. And that's okay.
Yeah,
Do you help people with silver sneakers?
Silver
Like
Sneak.
YMCA or through health insurance? Or-
Health, I mean, we don't have a silver, I think we might have a Silver Sneakers program here at Griffin. I'm not positive about that.
Okay.
But yeah, some of the Silver Sneakers programs are offered through different YMCA programs. But just back to your question about Oxford versus Seymour, to Jess's point, a lot of it's just allocation of dollars. And one town allocates dollars one way and another town allocates dollars another way. I think what we hope is some of this data flushes out some disparities, which it does and it has, to sort of shine like, okay, well, these guys are saying this and these guys are saying this, and we're seeing that it's sort of matching up with some health disparities. Maybe we need to try to level the playing field, right? So Oxford, I know, has some extra transportation because they applied for a grant. They use some specific state, funds to help their local transportation for seniors. Not every senior center does that. So they just operate differently. Each town operates differently. But that, to your point, that's sort of one of the reasons why we're doing this, is so that we could see where there's challenges between our towns, and then we share that with the state. The state's looking at that. So maybe the state needs to say, okay, well, if Oxford's saying this but Seymour doesn't have that, well, then maybe we need to figure out how to help Seymour to, you know what I mean? So
I do.
we're not there yet, but we're hopeful that some of this flushes out disparities that could bring change and make those disparities less.
Well, thank you guys that you're getting this data.
Yeah, and one thing I can say that's really just so beautiful about the valley is that it is doable here in the valley because it's small and people are working together as the region, because each individual town is actually almost too small. But bring us all together as the region and we can do it. And our board of directors has been really focused on the importance of being a region and making sure that all the citizens here understand the importance of being in the valley and working together, taking care of your neighbors and what that really means. Yeah. So I want to thank everybody for coming tonight, and please make sure that you take a copy both of the Community Health Improvement Plan and the executive summary of the Community Index. Make sure we have your email addresses so that we can keep you informed about other forums that we're going to be doing in the near future. We'll probably have another 3 or 4 next year as well. I don't think we'll compete with the holidays coming up. So thank you all for coming.